We're alive. Hello, everybody. Happy Cinco de Mayo. I am so excited for today's presentation. You guys are going to freak out when you see everything that we have put together for you guys. All right now in the comments, just tell me who you are. What is your specialty? Are you a hygienist? Are you a speech pathologist? And then the number of courses that you have already taken. I got to make sure that I'm live everywhere. It's saying that I'm not live on Facebook for some reason. So I'm just going to see if I can ignore that. Alrighty. Super excited. Let me open up my comments. It's on a different screen. Oh my goodness, you guys. Okay, awesome. I think I can see everybody. Yay. All right, you guys are ready? Ready to celebrate Cinco de Mayo? Here we go. Oh, let me go live on Instagram. We're going live on Instagram. I have a new puppy. Is the audio good for everybody? Okay, I think we're live on Instagram now. Welcome everybody to Cinco de Mayo. Today we're going to be talking about Myo Circle, our advanced course in myofunctional therapy. We only teach it once a year. It is incredible. And this is not coming from me. This is coming from all of our incredible students that have taken our course. We have dentists, pediatric dentists, orthodontists that have already taken this course, speech pathologists, dental hygienists, and OTs and PTs also. We have opened up. We follow what the IAOM says. So if they say you can take a myofunctional therapy course, we allow you. All right, let me put the screen to the side. Let me share the right screen to you guys. It's going to be a window, and it's going to be this one, and it's going to be present. All right, everybody can see it? Maybe? Here we go. Yay. All right, hi Renata, Lindsay from Niagara, Ontario, RDH myofunctional therapist at Myo Niagara. That's cool. I have done 2 courses, more recently foundations. Yes. So tell us, Lindsay, since you've already taken another course and you did foundations, you don't have to name the first course that you took, but how are they different? How did you like foundations? And you can be totally honest. I'm going to serve myself some yerba mate. I'm not sure if anybody drinks that where you are. This is like what we do in South Brazil for just whenever we are in community sitting in a circle. And yes, it's gross, and we share the same thing, same drink with everybody. All right, guys, I'm not sure. I don't think we're live on Facebook, but we're live everywhere else. So if you're seeing this, write on the comments so I can see that you guys are here. Everybody ready? Grab your cell phone. I'm going to need everybody with your cell phones out right now. Go ahead and do a screenshot so you can share this later to your stories and your social media. All right, ready? You're going to need something else for your phone. Here we go. Ta-da! So this is the Fiesta checklist. Before we get started, make sure to grab your bingo card. So if you guys know, every time we do course promotions on here, we always play bingo. It is super, super fun. So there are tons of myofunctional therapy terms. And as I'm talking, it's starting, whenever I start the presentation, it doesn't start right now, but whenever I start the presentation, you guys start checking off your words for bingo. And whenever you fill up your card, so the first person to fill up their card first gets Myo Circle for 50% off. It is insane, 50% off. So here we go. Ta-da, the first people just get bingo. Oh, you have to shout Fiesta on the comments. Okay. All right, everybody got it? Let's see. Law Foundations completely changed how I practice. Very good. Hey guys, Laura Murphy, hygienist, myofunctional therapist, 2 Myo courses. Foundations was super comprehensive, and I loved all of the input from the mentors. Very good. I think that the biggest benefit that we do have is that we have different mentors. And you know what? I forgot to put the mentors in this presentation, but at the end, I'm going to pull it up and I'll show you guys who the mentors for Myo Circle is. That is super important. All right. Hey, Chrissy, how are you? Fiesta. So if you fill up your whole card, you do Fiesta, okay? All right. Are your cases getting a little too hot to handle? Introductory courses didn't prepare you for complex cases. You know the what, but you're still struggling with the why. When I took my first course, so I actually studied for 2 years by myself, taking courses in universities in Brazil. If you guys are not aware, Brazil is the #1 country in the world in myofunctional therapy. They're the only ones that have a specialization for speech pathologists. It's 500 hours plus in 2 years of courses. So it's very medical. It's completely different. It's recognized by several of the medical what is it called? Boards in Brazil. So the Sleep Medicine Board also allows speech pathologists to become board certified in sleep. So it's a really, really big specialization over there for a speech pathologist. And that's why we get so many research coming out of Brazil. I never wanted to teach myofunctional therapy until I started sharing with my Brazilian colleagues what I was learning in the United States. And they would look at me like I was crazy. Like they would be like, Renata, we were doing that 20 years ago in Brazil. How are you still doing these exercises? How are you still prescribing an exercise for 2 minutes? How are you still doing button pull? How are you still doing the popsicle stick in the mouth? So they get mad. Like Brazilians are fiery, which is perfect for today's topic. If you guys don't know them, and they would get so mad at me. I had one of them that told me she was going to rip the paper in front of me because I had pre-selected exercises for my patient. And anyway, so that's why we decided to put something together, because I want to make sure that our level of evidence, our level of standards stays high in the United States, so we can keep being respected by our other professionals. We can keep getting good results and fast results and being able to show people, listen, what we do really works. It's incredible. And here are my results to show. So that is why. So let's see what else we have here. So this is for you if you're second guessing your treatment plans, your patients plateau, and you don't know why. You feel confident with simple cases, but avoid complex ones. You're referring out cases you should be able to handle, and you're tired of guessing. Can you guys relate with any of them? So how spicy are your cases? Let's look at some typical cases to see where they rank in spice. Isn't this fun? And if you guys get a line, the first person to get a line on your bingo, write bingo, okay? So I know. So let's talk about a mild sauce case, which is going to be the straightforward post-tongue tie recovery case. So this beautiful little girl came to me. She didn't need expansion at the time. Whenever we evaluated, the mom already knew about tongue tie. She had an older sibling that had issues with tongue tie. They've had releases, so they were very aware. And so we just did therapy for a tongue tie release. And look at the changes that we got just with that. This is after, the photos are after 4 months, the photos of the tongue. So before therapy, and I love to show patients before therapy and after therapy to be able to show just with therapy how much better the tongue position is going to be, the tongue mobility is going to be. And then we had a release done by an incredible tongue tie release provider. And this was what it looked like a week after. And how many of you right here can agree with me that you see a tongue like that a week after and you go, uh-oh, my dog is crying. I'm going to have to bring her in. Hold on. Come on. Guys, this is Capri, the newest edition. And it's not Capri, it's Capri. You can ask any Italian. Everybody says Capri for some reason. It's Capri. And this is she. She is eating everything in my house, all of my flip-flops. But she's so cute, so she can. All right, even though we're talking Mexican and you're a little Italian, how many of you have looked at this tongue and gone like, oh my gosh, are we supposed to mark our bingo cards if we see the word that you hear? So you have to hear me say the word. I have to say either myofunctional or tongue tie. I just said tongue tie. So if you have that word on your card, make sure you mark it. So how many of you have had a tongue that looks like that a week after and you're like, oh no, it's already reattaching. What am I gonna do? Is it an incomplete release? What happened? Is this person just likely to reattach? And yes, most of the cases you're kind of freaking out in the beginning. But one of the things that I have learned along the years with tongue tie releases is that we have to be patient. We have to be patient. And a lot of cases are going to look like, oh my gosh, this is awful. They're going to need a second release. And you're already seeing the signs a week after. However, we kept on going. I usually don't start serapeptase. Anybody here using serapeptase? Say me. I don't start serapeptase until I'm one of the only ones that does it this way. Everybody likes to start early. I don't. See, some people would recommend it that 1 week. I don't. I don't think you should put serapeptase in an open wound. However, I usually start my cases after it's closed. So sometimes at week 2, most times at week 4. And then 4 months later, look how much better her tongue looks. But not only that, she got changes all over her face because whenever we're doing myofunctional therapy, we're not just doing a tongue tie release. We're not just going to move the tongue. How many people over here think that because somebody's in orthodontics, they cannot get myofunctional therapy because you cannot focus on the tongue position? Oh my Lord, there is so much that you can do in myofunctional therapy that is not just tongue exercises. However, you can totally go ahead and get that patient to keep the tongue on the appliance. That's a great placeholder, for them to aim to keep their tongue up there. If you're doing I can't share my whole protocol here, but if you're looking at what the tongue needs, after you understand what the tongue needs, there's so much that you can do. You can work with them throughout the whole orthodontic case. And I actually think it's so much better. There are so many orthodontists that recommend myofunctional therapy after ortho comes out. I think that's not a great idea because there's, they're so tired already of the treatment and having to start something new for 6 months, 8 months, a year extra. It's too much. So I like to do the myofunctional therapy while they're going through orthodontics so they understand that it's the same treatment. Stop touching my mouth. It's the same treatment. It's part of the treatment, And like that, after the appliance comes off, I do phase 3. If you know my protocol, what phase 3 is, and then it's easy. They're done shortly after the ortho comes out, so it works out. I thought my son was going to bother me, and I was going to say daughter, but I don't know if I can call dogs kids after I've had kids. It's kind of weird. But she is my little girl. All right. It's funny. When I had my first dog, she was a poodle. Her name was Dolly. And I always told everybody she was my firstborn because I was so in love with Dolly. Dolly was everything for me. I had her for 14 years. She was the cutest poodle. There you go. So mild cases. Those are easy, straightforward, right? And then we have a little bit of a hot sauce. So now we have mouth breathing. We have narrow arches. So this is the ortho-myo puzzle. This adorable little girl came to me, referred from a pediatric dentist for a tongue tie. How many of you would go ahead and get a tongue tie release on this child? Can anybody tell me what you see? Oh, Diana's saying, oh, do you remember that, Diana? Hey, how are you? You're from Canada, right? One of our students is here, and she took, what was it called? Our first course before we changed the name for our courses. It was Launch Your Inner Myo. I remember now. That was a great course. You guys are awesome. You got to come back and take Myo Circle now. It's life-changing. So mouth breathing. Okay, what do you guys see on the first photo of her wearing the white? Body work first, posture symmetry. So a lot of her posture can be corrected with myofunctional therapy. I do like to work on that first. Anybody else? What do you see on the first photo? This one that screams, we cannot do the release right now. Anybody? And look how restricted she was. Crazy restricted. So on their treatment plan, on their history form, the mom she could not breastfeed. She had problems latching and not producing enough milk, which I explained to her the correlation that a lot of, don't bite my wire. Oh my gosh, child. See, she's my child. If my microphone turns off, she just chewed up the wire. So not producing enough milk, so your hormones produce milk after you have a baby up to, correct me if I'm wrong, 3 months or so. After that, the suction of the baby has to be productive enough. The hormones kind of slow down. And if the baby is not successful in sucking the milk out, you'll stop producing. Ear tubes. She had ear tubes at 2 years old. She has a stuffy nose, allergies, seasonal allergies, frequent upper respiratory infections. The eyes look open while sleeping. She has this tongue sucking habit. And if you guys have had a tongue sucking patient, it's one of the hardest things to correct. She takes a long time to eat. She's a very selective eater and doesn't like certain textures. So that's what she presented with. Let's see. She needs a release, but why? So open mouth posture. Why does she have an open mouth posture? There are a couple signs on her face that scream white sclera. Very good. Diana has taken one of my courses. So she has this white sclera underneath her eyeball. So that's one of the signs. What else? On her lip, it's a specific. Sabrina. Yeah, Shelby, good job. ENT referral. Sabrina said adenoids. This is the adenoids facies that they call. So you can see the kind of the bags under the eyes, how sad the eyes are, where you can see the white sclera. And the other sign is the everted lower lip. Look at her lip and how it's turned outward. You can see the vermilion border outside. That usually tells me adenoids are enlarged. One of the biggest reasons why kids reattach after a tongue tie release is because of nasal obstruction. So this is very, very, very important for us to look at before we do a release. So I sent her to an ENT. The ENT looked at the tonsils. I don't think they were enlarged. She looked at the adenoids and they were very enlarged. like 90% blocking her airway. So we decided to do the surgery first. We did the surgery, and since she was already under, I did recommend lip tie and tongue tie release at the same time. I usually don't recommend tonsils to be done at the same time as tongue tie release because it's so sore already in the throat. It's going to be also sore. Oh, Fiesta, one line. Bingo, bingo. A lot of people are getting bingo. Okay, everybody who's getting bingo right now, just one line. Email. So I'm going to say the names here. We have Laura Murphy, Chrissy Boldra, Laura Murphy again. Okay, both of you. I'm just getting double comments. Sorry. You guys send an email to admin@airwaycircle.com and write down Fiesta one line on the subject. And you guys are going to get a little, a free gift. Let's see what else. So where was I? I forgot what I was saying because I saw you guys got Fiesta. But anyway, so I sent her to an ENT. Oh, I don't recommend getting the tonsils and the tongue done at the same time because you're so sore. It's difficult to eat already. The child's going to be miserable. Yes, it's going to, they're going to get through it. But if it's a child who is younger, who is, or has behavioral issues or has special needs, if it's a case like that, then I do usually, and the tongue is extremely tight like hers, then I probably would recommend tonsils and tongue tie. But I'm very, very careful recommending those. If they can handle a tongue tie release later, I'd rather them wait. How do I get a bingo card? Oh, we had a QR code in the beginning. Let me go back. Right there. QR code. Anybody who has not gotten a bingo card, go ahead and get your bingo card. You got 5 seconds. 5, 4, 3, 2, 1. You know what? I don't think that you guys can see my presentation. Oh, you can see my presentation on on Instagram. Somebody else got Fiesta on Instagram. Nezzy. Is this after the expansion also? Now, I'm thinking that I'm not sure if you're talking about the second case. Okay, you guys got it? Bingo, Shelby, you already got the whole card? Shelby, that's kind of difficult in the beginning to get the whole card, but go ahead and take a photo of your card and send it to me. And put the time right now, 8:21, so we can verify. Okay, awesome. We can verify later to make sure I said all those words. Okay, let me see if I can go through this again. Isn't that such a beautiful presentation? My amazing team put it together. Amanda, thank you. All right, let's see. Here we go. So this is not after expansion. This is the before and after right there on the top. Do you guys want to guess how many sessions I saw her before she looked like that? No, I thought you said bingo met one line. Yes. Bingo. Oh, sorry. Well, let's do that. I think I'm going to change it. Bingo is one line. Yes, and Fiesta is the whole card. No, that's what I said earlier. Yes. So whatever, as long as it's one line, just write on the admin@airwaycircle.com. Say I got one line. Okay, so 3 sessions. Anybody else wants to guess how many sessions I saw this little girl for until we got those results of closed mouth posture? The correct answer is 0. I only saw her for an initial consultation and a full evaluation. And then when she arrived for her first session, I looked at her and was like, Mom, she looks different. Let me get a photo. Because you can tell right away if your patient changes. Like, you can tell right away. So she got me a photo of her and I was already beyond myself. Why? This goes to show that myofunctional therapy is not about exercises only. The initial consultation, the second that the patient is in front of you, you are already doing therapy. So I already recommended nasal hygiene, changing the sheets to hypoallergenic sheets, eliminating all the stuffed animals in her room, clicking her tongue, brushing the spot. There are certain things that I recommend that are my recommendations. And if you guys have seen my the workbooks that we have for children and adults, I have my recommendations on here. So they get a book like this and they can go through. Here are the recommendations. Look how cute this is. I know my screen is small, but I'll show it to you guys later. Or you can go on the website and see it. airwaycircle.com, go in the store, and you can order the workbooks. The patients can order for themselves or you can order in bulk. So went to the ENT, did tongue tie release, adenoids out, and all of a sudden she's doing so much better. And it's funny because I sent her to a different ENT first, and I had the ENT letter here, but I removed it because he did recognize, the patient came from this type of professional who does something with her facial muscles, and she has a tongue tie. He wrote everything on there, but he looked at the mom. He says, I don't think her tongue tie is an issue. Like, I don't think it can change anything in her life. And I'm going to show you guys how it can change. So to go back to what I was saying, myofunctional therapy starts the second that you see them. You're already giving them so many different recommendations, eliminating dairy because it's inflammatory, all these different things. And they made those changes before I saw them for their first session, and she was already breathing better. And then I did get messages from the mom. I asked, how about during sleep, or are the eyes open during sleep? She said, let's see. She does. Oh, I was asking about eating earlier. And she said she does eat a bit fast, but only when she's not distracted. And I think she had over here, takes a long time to eat. That was history form. That was before. And now mom is saying that she's eating fast. And then the tongue sucking is still there, but not as much. So that reduced. Her nose is not stuffy, and she is mad for making her blow it. And then since she started therapy, she has made on a row every single time. So how cool is that? Now let me show you guys the changes that this little girl got. All right, so that is her bite. She was a class 3. I sent her to an orthodontist, and they had recommended 4-pull face mask for her right away. And that's her suction, which she couldn't even suction before. And that was her suction after the tongue tie release and after we healed. But her bite changed, and that really, really surprised me. I was not expecting that much change just with myofunctional therapy and tongue tie release and the tonsil. So, okay, hold on. I want you guys to pay attention to this girl's speech. Every single time I saw her, she spoke very slowly, and she would look up and she would speak very slowly, like she was really thinking about things. So I'm going to play this for you. Let me know if you guys can hear. I didn't think about doing a video of her speaking before, so mom just sent me a random video where she was talking. So here we go. Pay attention.
Uncle's side. And T7.
Okay, did you guys see that? Now the second one.
You want to, baby? Don't you need me like I need you now? See tomorrow, but tonight for crazy. All you gotta do is just meet me at the opposite.
Isn't that insane? And the ENT said the tongue tie was not a problem. Incredible. And it's funny because after she started healing, I looked at the mom, I was like, Mom, she's talking different. She's faster. Like, what is going on? That's one of my favorite videos to show. I love her little song. Somebody's asking, can you please explain why the eyes open during sleep? My daughter with large adenoids does this as well, getting them out at the end of the month. Congratulations, Sabrina. That's a great question. I'm not sure. It has not been proven that it's related to sleep disorder breathing, but I personally think there's a small correlation. I think that your body is trying to keep you alive, and there are certain things that happen, including I actually have a cousin that she used to sleep like that too, and she is the airway. I mean, you look at her, gummy smile. She had all the issues, always mouth breathing. So I'm not really sure. Here we go. Any questions? You guys are welcome to ask me. Now let's go to the fire sauce, a complex case. Let's talk sleep apnea, tongue tie, hypoplastic maxilla, and retruded mandible. What would you do? This is a patient that came to me from Italy. His AHI is 12.2. That's as much as he can suction, which I was very impressed he could suction. That was his tongue elevation. You can tell his high vaulted palate, a little asymmetric on the palate, narrow. He could barely stick his tongue out. You can see the little not the dimple, but the notch on the tip of the tongue. And you can see how retruded he is. So as soon as I see this patient, I'm like, oh my gosh, it's a surgery case. And he's coming to me because he knows he has a tongue tie. That's all he knows. So do you guys want to guess what I did first? Anybody? I thankfully have some friends in Italy that are sleep doctors. So I sent them to my friend's sleep doctor. I said, before we do anything, I need a sleep study. So that's when he got that sleep study. What else did he do? And I wanted a CBCT. However, we could not get a CBCT anywhere. I require that for almost every patient. Sleep study and CBCT before I start anything. Can you please be quiet so I can finish? You need to lay down. All right, let's see what happened. Marpy, I know, he's such a good Marpy case, right? However, he told me, I don't want a Marpy. I don't want any of that. You know how guys are usually? They don't think there's anything wrong. They don't like to go to the doctor. It's just generalizing, guys. Not everybody's like that. But he was like, I just know I have a tongue tie. I just want to get it released. I don't want to do anything else. So I convinced him to go get a sleep study at the sleep doctor, sleep surgery. And whenever he came back, this moderate sleep apnea, I said, well, we have some options. However, the culprit right here is really the small maxilla and the retreated mandible. We got to figure out how to do that. And a case like this would be a little scary and dangerous to release the tongue. How many of you would recommend this tongue tie release? How many of you would say, nope, no room, too dangerous? I know a lot of people talk about the width of the palate, so the intermolar width. If they suction and they get this tongue overflow, that they would not recommend getting their tongue tie release. Here. And to me, it's even more dangerous. Everybody's saying no. It would be more dangerous, I think, when they are retruded to get their tongue tie released. However, I have some things that I look at in a case to be able to decide if I would recommend, even though it's not my final decision, if I would recommend, okay, I think it's going to be safe. Let's go talk to the surgeon and see if they recommend the release also. Guess what we did? He actually went back to the sleep doctor and he got a DICE. Does everybody know what a DICE is? Stop. Drug-induced sleep endoscopy. It's whenever you go to sleep and they put a camera in your nose so they find out exactly where you are obstructing. This is very, very important. Before you do any major treatment or recommendations for treatment in a patient, it's important to see where exactly this patient is obstructing. So we did send it to, he did do the DICE, and during the DICE, they did a radio frequency of the turbinates. Does anybody know what that is? They put a wand inside the nose. And with radio frequency, they reduce the size of the turbinates. It's not long-term, but it holds for like a year, and then they can breathe better. Every time you have a lot of resistance in your nose because you have nasal obstruction, it's good to release, improve the nasal airflow so they can reduce the collapsibility also in the airway. So we did that. DICE and radio frequency of the turbinates. The sleep surgeons said no tongue tie release and recommended, I didn't do a photo of his palate, recommended pharyngoplasty. Does everybody know what pharyngoplasty is? Good. So pharyngoplasty is whenever they reduce the size of the soft palate. They used to burn it or cut it. Now they usually just lift it. So they do a flap on the muscles on the soft palate, and they just lift it up. So if the base of your tongue, if your tongue is falling down in your airway and obstructing with the soft palate because the soft palate is too low, they raise it up like that. Your tongue still falls back, but it's not going to obstruct. So your airway stays open. Is DICE like the Sono band? No. DICE is a diagnostic treatment that, it's not a treatment, it's a diagnostic procedure that sleep physicians do. So they take you to the OR, they put you to sleep, and they put a camera inside the nose, and they can see what's happening in your airway. And then they also put the camera inside your mouth, and they can see what's happening in your airway whenever you're asleep. So for example, sometimes the epiglottis is going to collapse. Why would you recommend this patient having soft palate surgery if it's actually the epiglottis that is collapsing? So it's important for us to understand exactly where the obstruction is happening so we can better target our treatment. In Europe, they usually don't recommend all of these different types of treatments for sleep apnea if they don't have a DICE first. Over here, it's if you go to a sleep surgeon, sleep physician, usually they do it, but it's harder for us to hear about it here. I mean, you go to a sleep dentist, they're going to do a mandibular advancement device, you know. Was this all done before therapy started? I go ahead and I start therapy because sometimes it takes 2 months, 3 months before they can get, a CBCT or a sleep study. Ideally, I would like a CBCT and a sleep study before I even start, because I know from that day one that I'm talking to them, things are already changing. Things are already improving. So as early as we can get it, I want to know what is the baseline, how do we start, because I know there's going to be changes. So as soon as we can get that information, It's great. However, there was one of my sleep study persons that I used to send to here that it was taking like 5 or 6 weeks for them to get a sleep study. I said in 6 weeks, your sleep's already going to be different, you know? So now I actually have something that I give to my patients called the tip track. You guys can go on the Airway Circle website. They're under partners. You can also look at intake breathing over there, the breathe right strips. They're intake breathing. So they're much better. They have the little magnet that you put in the nose and it really opens up the nose. Something else do you guys know how to check for nasal valve collapse? Oh my gosh, I was not supposed to go into all of this here. So in order for you to find out if somebody could really benefit from something like intake breathing, you have to ask them to breathe in lightly. It doesn't have to be strong, but whenever they breathe in, do you see the nose collapse at all? If you see the nasal valve collapse, that's when it would be good. And then you can ask them to do the Cotto maneuver. Oh my gosh, I'm doing a class. I'm not supposed to do this, but the Cotto maneuver. So whenever you take a deep breath in, and then you guys can try with me. You put both of your fingers on the sides of your nostrils. You pull the nose out and up, and then you can breathe in again. How much better is that? So I remember before my MARPI, it used to be like 100% better. And now it's maybe 10% better. It doesn't make that much difference. And then there's another maneuver that Dr. Karen Davidson, it's called the Davidson maneuver. She created it, which you just lift the tip of the nose. If that improves rather than just breathing normally, then the place where you put the intake breathing, it's closer to the tip. Let's see what else. I got my sample for intake. Love them. Yes, you guys can get your sample on the Airway Circle website right now, right over there. Okay, so we got all the stuff done as I was doing therapy. He did the dice. And guess what? We got his tongue tie release. First photo, I want to show you guys how much his airway improved. So he's able to contract the throat muscles way more, or pharyngeal muscles way more. Do you guys see how low his soft palate is? I mean, his uvula. Usually if somebody has a very elongated uvula, it's from many years of snoring. And I think that he would probably benefit from reducing a little bit of the uvula, not a U-triple-P, not cutting the uvula, but cutting just the tissue that's sagging, not the muscle. And maybe lifting the soft palate a little bit. I think that would still be a good recommendation for him. However, I would love for these patients to get a MARPI first, because the second that you distract the maxilla bone, you're not expanding it, you're distracting, you're separating them. The second that you separate them, that soft palate may raise on its own. Because think about it, it's just tissue. In the maxilla, everything is attached. When you move the maxilla sideways, that tissue is going to lift up. So in an ideal world, we would do a MARPI before we did pharyngoplasty. I actually just saw him today. It's been like 3 months since I've seen him. I just saw him today for a follow-up and some more sleep exercises. So maximum interstitial distance, he started at 32. Oh, it's still a 32. His maximum opening started at 23, and he went to 42 today. I should have done the numbers for today. I copied them, but I didn't put it on here. But today was a little bit more than 42. Maximum opening with the suction was 9 millimeters, and now it's 26. Sorry, I skipped one, didn't I? Where's max? Oh, sorry, I messed up. The first smaller distance is on the bottom. You guys can correct me if I'm going crazy. So the maximum opening is actually 32. So we went from 32 to 42, which is improved already. The TIP, which is the maximum opening with the tip of the tongue, on the spot went from 23 to 27. However, it was at 30 today. And lingual palatal suction went from 9 millimeters to 26, which was also 30 today. So be patient with tongue tie release. It's going to keep improving. It's been months since we've done this. It was last year when he got his tongue tie release. Long time ago last year. I can't remember. Maybe it was August of last year or the year before. I don't even remember. It's been a while. Look at that, 5 months post-release. So it's been even longer than that. It's probably been a year. I don't remember. I need to look at the dates. But it's even way better today than it was at 5 months. Now, you may look at this tongue tie and you may say now, well, he has tons of scar tissue. Do you see how whitish his tongue was already on that first photo? See how white it was already over there? Super blanched. After therapy, we got the tongue to have more mobility, improve greatly. A month after the release, when I saw that, I was like, oh my gosh, what are we going to do? We did use serapeptase with him. I think that the most difference that you can see is the 1 month and the 5 months on the suction. Look at how much that serapeptase broke down that tissue. Incredible, right? So I don't start serapeptase early. I don't think it's necessary. I do get great results starting later. However, I do believe he'll still benefit from a second release. So I did tell him today that if he decides to go through MARPI or actually the soft palate surgery, that I want him to re-release his tongue with sutures. So the issue is that the release provider that we found in Italy did not do sutures. He would not answer my emails. I tried reaching out to them. He wouldn't talk to me. And he did, I think it was a diode laser, which is not my favorite. I don't like it. Don't like how he does with the tissue. And he had a lot of pain. Like he was in major pain afterwards. He could not even open his mouth. So I don't know. I was not there for the procedure. I don't know exactly what got done, how it was done. But unfortunately, he ended up with a lot of scar tissue. However, he was extremely restricted also. You know, I'm not a release provider. So I'm not sure what this provider had to go through to be able to release this tongue. However, I think he would benefit from a second release. So we did do a tongue tie release, even though his structure was so far back. He was only at 32 molar or 33 molar to molar. But with myofunctional therapy, look how much his airway improved. So let me show you guys what else happened. I just got back his sleep studies. So he went from an AHI of 12.2 to an AHI of 2.5 after myofunctional therapy, radio frequency of the turbinates, and a frenectomy. And then he also got a mandibular advancement device. And his sleep study with the MAD was AHI of 0.6. How insane is that? His RDI went from 17.6 to 5.1 to 4.4. His ODI went from 3%, went from 11.5 to 2.6 to 1.3. And his desaturation events, I think that this is the most significant one. He was having 72 desaturation events before treatment. 15 after myofunctional therapy, radiofrequency of the turbinates, and frenectomy, and only 2 with a mandibular advancement device. What you guys are doing does work. You just have to be able to recognize exactly what is in front of you and what path to take, what is okay to recommend, and what exercises to do. If you don't understand what you're looking at, you're going to have a harder time planning the treatment for these patients. So do you guys want to guess why did we go forward with the tongue tie release? I got my sample from intake. A lot of them are there specific sleep exercises you recommend in these types of cases, 100%. And you will learn all of them on Myo Circle starting August 1st. So why did I recommend? Why did I say it was okay? The biggest reason why I said it was okay for him to get a tongue tie release, it's because he did not have an enlarged tongue. If he looked like this, super retruded, but his tongue was huge, I would have said no right away. There's a new study that just came out today from the incredible Brazilian lady, Gislaine Folha, that was talking about the strength of their swallowing. So people who are overweight and have these overweight tongues, they're I think it's the hyoid bone that drops. So the distance that these muscles right here have to fire for you to be able to swallow, the distance is longer, the effort is more. So their swallow is super weak. So these people with sleep apnea also have a harder time and their swallow is not as good and not as strong. So they're more likely to aspirate, they're more likely to choke, they're more likely to have these issues. And it's silent because from snoring, oh yeah, that's what they said, that was super interesting. From snoring, so if you snore over and over and over, all of these muscles in your throat, or all these muscles that we're working on right here, they get numb. So you can no longer feel anything back there. So whenever you have a little bit of water, a little bit of food, a little bit of particles actually going to your lungs, your body does not signal to close, the epiglottis to open and close, and it goes into it goes into your lungs instead. And it's a big problem because these people can end up with, lung infections over time and just being more sick because they cannot even feel that this is happening. It's silent. But great research. We just shared that on Airway Circle. Go check it out. All right. So isn't that insane changes? However, so today I did see him and I did still recommend, I still think you should go get the MARPE done. And so those are my recommendations. MARPE, MMA, so MARPE consultation, MMA consultation, and the pharyngoplasty consultation. I did send them to all three because we got to, find out. I mean, I did ask him, do you want to use the mandibular advancement device forever? Like, what is your plan? You're still young. There's a lot that you can do. There's a fantastic MMA surgeon in Italy. He's one of the best in the world, Dr. Ruffini. And I said, you're already there. I mean, go see him and see what he can say, because I don't know if he would benefit from width in this case, but his main issue is AP. Transverse is a problem, but if he had an enlarged tongue, yes, 100% we need that width also. But I think he would be okay just with MMA surgery. Release the tongue tie, maybe pharyngoplasty. They just have to do a little bit of work to this. The uvula is a little bit too long. But anyways, I will keep you guys updated on what's working. All right, so from spicy cases to stable, clinical clarity changes everything. When you understand the why, treatment becomes precise and results become predictable. So this little girl up top, this is after 6 sessions of myofunctional therapy. Look at the body asymmetry. Look at her shoulders. Look at the way that the feet are standing. Everything can change if you know exactly what to target. Look at this little boy only after 3 sessions, how much tension he was holding on his body. But that's only 3 sessions. The suction, he could not suction at all. And this is another before and after 3 sessions only. I looked at this boy. I just saw him yesterday and I was like, oh my gosh, I need a new photo. You look like a different kid. Usually your kids are going to look like a year older, and it's only been a few weeks or a month or 2. I'm like, no, you look a year older. I want a new photo. The main change of this lower patient right here, I think the photo was taken a little bit of a different angle. However, look at his lips. One, you can see that his nose is a little bit higher. The reason why the nose looks better and it's a little bit higher is because we got the tongue to be on the palate now. The tongue is what gives stability for your whole orofacial complex. All of these kids are going to have low, they're going to be looking down. Look at the little boy up top. Do you see how his head is kind of facing down a little bit? And then on the second photo, his head is up. So that's why the white sclera, that's where the white sclera comes. It's because the low tongue position. As soon as you get the tongue to be in the right place, all of a sudden they start growing the correct direction. His lips look so much better. Anyways, so such a good case to share. So don't get burned by fire cases. Myo Circle is designed to give you the why behind the treatment, providing the clinical clarity you need to stay cool. Think of it like a Myorita, the perfect way to quench the fire and find your balance after a spicy case. So let's talk about the perfect Myorita recipe. Are you guys ready? I love this. All right, Myorita, the salt, the rim is the structural boundaries. So let's say that that's the palate. The liquid is the flow, so the airway and breathing. Let's say that the straw is the tongue. So it's the tongue function, the tool that makes it all work. Now think with me. If your rim is too narrow or your straw is clogged, the system fails. We're going to fix the recipe in Myo Circle. Why your cases aren't progressing? So you may be treating muscles without the structure. You're treating the structure without looking at the airway. Or you're treating airway without neurology. You're not sequencing therapy correctly, maybe. A great mayorita quenches a thirst, but a fiesta isn't complete until you break open the piñata. Who had piñatas for their birthdays? Oh my gosh, those used to be so much fun. Let me see if there's any questions I need to answer real quick. Are there any specific sleep exercises? Yes. Do you recommend the MAD after the second sleep study came back? No, we actually did when I do tongue tie release cases, when they are retruded, when they have this maxillary hypoplasia and retruded mandible, I usually send them to the dentist first for them to go ahead and get a MAD, because I tell them, listen, this is, I don't usually recommend, because your structure is too far back. So if you get a tongue tie release, you're more likely to obstruct. However, your tongue is not enlarged. So I think you're going to be okay. But let's go ahead. Excuse me. Let's go ahead and get a mandibular advancement device in case. Oh my gosh, my dog. What are you doing? She's on my desk. Just in case your sleep does get worse, we have the mandibular advancement device that can hold us off until we decide what other treatment to do. Interesting that REM sleep decreased after myo radiofrequency and the turbinates and the frenectomy. I know, right? So it was actually slightly elevated before. After myo was perfect. And then it got elevated again with the MAD. I'm not sure why. But I am going to ask a sleep surgeon. All right, so let's see. We've got the perfect Mayorita recipe. The salt, the liquid, and the straw are all in balance, right? So the palate, the tongue, and the airway. Everything is working perfectly. But even with the right ingredients, sometimes clinical myths act like a wall between you and your patient's success on those spicy cases. It's time to put down the glass and grab the stick. Let's smash these misconceptions to reveal the clinical treats waiting for you inside Myo Circle. So myth number 1, doing exercise is enough to fix the problem. If you only treat without understanding the why, the dysfunction often returns. The Myo Circle truth. We move beyond exercise lists. We teach you clinical reasoning, how to sequence therapy based on how the function and structure respond, ensuring results that actually last. Myth number 2, myofunctional therapy is a solo treatment. Thinking you have to fix it all alone leads to burnout and limited results for complex cases. The Myo Circle truth. Success is found in the interdisciplinary team. We teach you how to co-manage cases with orthodontists for expansion, ENTs, and sleep specialists, so you aren't a lone wolf therapist anymore. The thing is that most people understand they need myofunctional therapy, but they're not really sure when to start. And a lot of times they start in a really bad structure. I actually went to MARPI Masters, and one of the doctors over there kept showing some crazy cases and saying, I'll send them to myofunctional therapy. And I'm looking at those cases and I'm saying, no way. Myofunctional therapy wouldn't do anything to those crazy. They were very severe cases. So we're going to teach you guys exactly how to look at a patient and understand exactly where you should start. Myth number 3, I need to be an expert in everything before I start. Clinical paralysis keeps your practice small. You don't need to be an expert on day 1. You just need a safety net. And the Myo Circle truth, you are not on an island. You're not an island. Our 16-week mentorship allows you to troubleshoot your actual spicy cases with me and our mentors in real time. We'll build your expertise while you treat. So Myo Circle is the next step for you if you've taken foundations or an equivalent course. You're seeing patients already. Actually, I usually don't let anybody take Myo Circle unless they've been seeing patients for 12 months. Unless you've taken foundations, because foundations goes, I know what you've learned, and you don't need, a year of treatment before you can start with us. You're seeing patients already. You want to confidently treat complex cases, and you're ready to stop guessing what you do and why you're doing what you're doing. And we have proof.
been a speech pathologist for nearly 30 years. I've been a myofunctional therapist for 5 years. I was an endoscopist diagnosing severe swallowing disorder. And you've already blown my mind. I'm just like, oh my gosh, I've been to so many courses on the mouth and the throat and how the tongue moves and how our swallowing moves. And you're challenging me already.
Look at that. I'm mind blown over this course already on day 2. I've already gotten my money's worth for this course. It's a totally new way of looking at the exercises and what we're trying to accomplish. Some other testimonials here for you. I'm going to read them. This course has been a game changer for my practice. I now have, or probably now, have a better understanding of the why behind the how, as well as a wealth of knowledge on all things myofunctional therapy related. Best course ever. You're amazing. I'm loving Myo Circle. Thank you for bringing depth and critical thinking to my exercise prescription. Thinking critical and understanding the why of prescribing exercises. My assessments and consultations are more thorough, and I feel like my patient education is more complete. This course is a confidence builder for sure. Amazing course and amazing instructors and mentors who are giving, who are so giving of their time, there to help you and guide you and give continued support even after the course is over. That is huge, guys. I used to feel like I was on an island alone and no longer feel that way. I may be an island in my area trying to find like-minded providers, but now I have the Myo Circle cruise ship to board anytime I need. I love that, and that's exactly how you should feel. Glad I can help. The course really was all the difference in the world for me. Somebody said, I quit hygiene 3 months after Myo Circle course and have a high acceptance rate. This was the only course I've taken. I've taken 3. This was the only course that showed the why behind sequencing and treatment planning. I now feel more confident prescribing exercises instead of just throwing things out there to see what sticks. Myo Circle has been the most helpful tool, support, and learning experience that I have had with myofunctional therapy. The sheer knowledge and resources that the whole Airway Circle community shares is incredible. I feel more empowered and ready to help my patients in a more thorough way. Thank you, Airway Circle. This last one says, Myo Circle has helped me to gain more confidence. Thank you so much. I have seen this trend going on so much where people are using their teeth to produce that sound with spoon on every bite. I find it very irritating though. I was not aware that it's a dysfunction. Love this. I will need to watch this a couple more times. Thank you. She said over there that he has enhanced the way that she sees chewing and swallowing. Ta-da-da! Here we go. Your seat is waiting. This is a $500 early bird discount for everybody who is here right now. It is only valid for 7 days. There's your code. There's your QR code that you can use, or you can type MC502 off. What is included in Myo Circle? 16 weeks of advanced clinical mentorship. 16 weeks. That is such a long course. Path to the IOM certification. After you take Myo Circle, you can still get your COM. Weekly mentorship on your actual cases. Clinical reasoning framework, not guesswork. Step-by-step therapy sequencing. Interdisciplinary case management training. And direct access to me and our mentor. Starts August 1st. Don't let this be another year that you're still trying to guess what you're doing with your patients. Come join us. Can I take this off the screen, guys? I actually want to pull up our Airway Circle. Let me stop sharing with y'all. Oh my gosh, if I know how to do this. Close window. Are you guys going to see anything? Stop sharing. So let me put this other screen here, and I'm going to share with you guys who our mentors are. So if you guys have not noticed, every single time that we teach a new course, we have different mentors. Let's see. Let me share one more time. Share screen. Window. This one. Ta-da! Can you guys see it? Okay. So if you guys have not been to the Airway Circle website, please go check it out. If you go to the membership, you're also going to see that we have 2 extra memberships that nobody knows about. Now it's on the website, but it's the Foundation Study Club and the Myo Study Club. So they're study clubs just for people who have completed our courses. So the Myo Study Club are only for Myo Circle graduates. It's freaking amazing. And Foundation Study Club is only for Foundations graduates. So usually you do Foundations and then you go through a Myo Circle and join Myo Meets at the end. But we have an incredible WhatsApp group that we're sharing cases, we're sharing research, we're sharing questions about anything. We have monthly meetings and we have bonus courses, a ton of bonus courses on Myo Meets. So if you join Myo Circle, you're going to be able to do that. All right, let's see our courses. So Myo Circle. Oh, there's another surprise there. So Myo Circle, here we go. I want to show you guys really quickly our modules. So fundamentals, guidance call, which now I'm calling initial consultation or guidance call or welcome call. Myofunctional therapy full evaluation. I usually separate them into clinical assessment and functional assessment. Our exercises, which we have a surprise about the exercises that I cannot share yet, but I'm super excited about it. We go through therapy sessions. How do you progress? So I have actually created a way to check progress. Nobody else does this, but it's super easy to know when you're done with therapy by doing this. Swallowing dysfunction and tongue thrust. So Myo Circle is advanced. If you look at the modules for foundations, you're going to understand we go a little bit more into heavy myofunctional therapy and tongue ties. But now Myo Circle, we go through, okay, the why behind the exercises, and now we're going to dive deep. So we talk a little bit more about swallowing dysfunction and tongue thrust. We talk about oral ties. We talk about oral habits. We talk about palatal expansion. We talk about sleep. We talk about TMD. We talk about orthodontic surgery. And I have never shared before, but I'm going to, for the first time ever, share my orthodontic surgery protocol post-op that I have learned from my incredible mentor, Mariana, from Brazil. She's the best in the world. And I am going to teach you guys exactly what to do. And I start my patients on day 1. You can start on day 1, but I'll share with you guys what I do. We go a little bit deeper in hypermobility, early childhood development, and more. So what are the bonuses? You get Intro to Airway for free. It's a $1,200 course with incredible 14 different speakers. We actually have a page here on the Airway Circle website on Intro to Airway. You can go see what the course is like, but you get that for free. You also get a whole year of the Airway Circle membership. Actually, it's not a $450 value. It's $54 a month, so it's like a $650 value. And you get 100 brochures for you guys to go ahead and staple your card to it and start marketing around town. So our investment is $39.97, which I still think it's very reasonable. It is 16 weeks, plus you have a whole year of mentorship in the WhatsApp group. So it's me and Anne, and here are our extra mentors this year. We have Samantha Lewis, who is an incredible speech pathologist in the UK. And we have Ashley Beals, who is an incredible RDH and myofunctional therapist in California, who they're both Myo Circle graduates. So there's a little hint. If you guys are ever interested in doing more with your career, if you also want to be able to mentor and teach, Myo Circle is really the entry door for you guys to be able to volunteer with Airway Circle. And we have our amazing guest lecturers. These girls are actually not really guest lecturers because they have been with Airway Circle for so long, but my beautiful friend, Madison, Kimmy, and we have a class on orthodontic surgery with Rebecca Clark. Sam talks about play strategies in myofunctional therapy for little ones. Mary Frances Gonzalez talks about oral habits. And then we have 2 brand new speakers for Myo Circle that I'm super excited about. We have a class with Jenny Hobson. That's a 2-hour class on physical therapy secrets to unlock your TMD and facial pain patients. If you're a member of Myo Meets, so if you've taken Myo Circle, you already have access to this class. And then the beautiful Cynthia Peterson, who is one of the creators of the Ferris 6. She actually studied palatal suction for over 10 years. It was her by herself studying lingual-palatal suction for 10 years to be able to put into that research. So kudos to her. So she's going to be talking about the TMJ healing plan, 10 steps to relieving headaches, neck pain, and jaw disorders. You guys do not want to miss this. And actually, we always give a book away for every one of our courses. And for Myo Circle is actually Cynthia's book. So you're going to have her there. She's going to do a class, and then she's going to come back to answer questions. And we cannot go without our incredible Brazilian lectures. So these are all my mentors from Brazil. Patricia, Mariana, she is my favorite in the world. Marielle is the sleep girl. Roberta Martinelli is the tongue-tie queen in Brazil. Dr. Esther Bianchini is the sleep queen in Brazil. And we also have Dr. Irma talking a little bit about tongue-ties. These are all frequently asked questions. One of the main questions that I get is, do you offer a payment plan? Yes, we do. This is how you get it. You go to the website and you click on 3 installments. However, if you do 3 installments, there's no discount code. And you can get, certified through the IAOM. Foundations and Myo Circle are both eligible for certification enrollment. But the live sessions are all here. So if you guys want to take a look at the schedule, these are the dates that we're going to meet. It's always on Tuesdays at 8 p.m. Eastern time. Expect 1 to 2 hours. I talk a lot, as you guys can tell, and the girls are also always trying to make me stop at 1 hour, but sometimes I go over. And then we're going to meet on the weekend. I think it's a Saturday and a Sunday. Here it says 2 Saturdays. It's wrong. And it's at 10 a.m. EST. So those expect at least 4 hours each. I can go up to 6, but I try to stop at 2. But anyways, it's such an incredible course. You guys can go over here. So 4 months, 16 weeks, and read these questions. What is the time commitment? So each one of the modules you're going to watch on your own, and then we meet that week to answer the questions for that module. So there's 40 plus hours for our recorded content, which I have to re-add because I think it's more now, plus 20 additional hours of our live meetings. You're going to have quizzes throughout the way. You're going to have homework throughout the way. How long do you have access to the content? Forever. You never lose access. I believe that you guys respect your investment. You're not going to share this with anyone. And, you're a part of us. So super excited about this course. It's going to be great. And we are filling up, by the way. We stop at 20, so join us. Which professionals are allowed to take this program? Very important. Airway Circle follows exactly what the IAOM recommends. So speech language pathologists, registered dental hygienists, and dentists, of course, any physician who wants to take. And we make an exception for occupational therapists and physical therapists since they now allow, the IOM allows them to become certified. But that is it. We have several different speakers, instructors, and mentors. It's a different course. You're not going to find this anywhere. And plus, it is what Brazil is teaching. So anyways, do you guys have any questions before we go? Oh my goodness, lost my bingo card. No way. Did anybody get bingo? Can you please tell me which words are we missing? Have I not said all the words? Usually we have like at least 5 people that get bingo. Anybody? 50% off Myo Circle. You guys all got the code? Here, let me stop. Okay, stop sharing. Did you guys all get the code for the $500 off? If anybody has any more questions, feel free to email me, or you can email my assistant, Suzanne. Her email is admin@airwaycircle.com. Okay, how many words do you have left? Let me see on Instagram if anybody has made. How much is our course? It's $39.97. However, you get $500 off for the next 7 days. We have already the code for $500 off. Yes. Do you want me to put it back on the screen? I think I turned it off. Let me see if I can find it. I don't have that screen anymore. Let me see if I can find it. Does anybody have it? It was 5MC502. Hold on, it's just going to take me a second. But it's only for 7 days, and we're almost full. So as soon as we get to 20, I'm going to stop completely. And we have already had people who got the course at full price. So I'm just doing this because you guys are spending Tuesday with me. It is MC 502 off. I'm going to share. I'll share this on the screen one more time. So those who did not get the QR code, you guys can get the QR code. There he goes. Okay, I didn't say that word, Chris. I don't like that word. Okay. Only one missing word? Two missing words? Who has? No, missing. Okay, everybody's missing the same. I haven't heard. No, I did say oral habits. I did say oral habits. I did. Didn't I say upper jaw? His jaw's too far back. Okay, so almost all of you have only two. Does anybody only have one missing? If you only have one missing. Oh my goodness. Okay, so if Chrissy and Laura both only have two missing, I will allow both of you guys to get the 50% discount. I don't usually do this. So 50% discount for Laura Murphy and Chrissy Boldra. You guys can email admin@airwaycircle.com and tell Suzanne that you won Fiesta. And Shelby, you have $500 off. But Shelby, go ahead and message the team, and they will also give you a free gift. Anybody who's here, if you guys enjoyed playing bingo with us, send Suzanne an email, and she'll send you a link for a free gift. But you guys are going to get a lot of gifts when you join Myo Circle. You're going to get a whole box full of stuff. So thank you guys for playing with me. Super excited. Cannot wait to see you guys in Myo Circle. I promise you it's going to change how you treat and how you see your patients. You're going to start getting results faster. You're not going to be as frustrated anymore with your treatment plan. It's going to make sense, I promise. And you're going to be a part of us. So super excited. Thank you guys for hanging out with me. Have a wonderful night. We'll see you on Thursday Night Live. Bye.